who wants to go over some dental materials case studies. So, if you're either a dental hygiene student or a dental assisting student studying for your dental materials exam or your board exam, this is going to help you. So, I have been teaching for the board exam prep and tutoring students since 2005. This says case studies week 10 because this was part of our board exam prep academy classes. Okay. So, but you will learn some really good things. I'm just going to get right down to it. Let's teach you dental materials in a case study format. Okay. So let's get ready here. I'm just going to show the question first. Okay. So a dentist is selecting a material for posterior crowns that will provide durability and feel natural to the patient. Which material properly, oh, I spelled that wrong. No, which material property would be most critical in ensuring the restoration does not feel excessively heavy while maintaining strength? Okay. So, would you guess A, B, C, or D? And this is part of your dental materials properties. Okay. So, you need to know. Oh, sorry. I didn't mean to change it that much. You would need to know what all of these mean. And then you have to go back to the case study and say, okay, what is the dentist doing here? So they're selecting a material for posterior crowns. So we know posterior crowns, they need to be strong because we bite. We have very high, heavy biting forces. We're not biting directly on our front teeth, but guess what? We're biting directly on our back teeth. So they need to be stronger than the front teeth. When we're making an anterior crown, we don't necessarily have to worry about strength. So we could use a different material that looks better in the mouth. But for the back teeth, you can't see it. So there's a variety of different crown materials that we could use. But specifically in this case study, it says he or she wants to provide durability and feel natural to the patient. So we need something that's durable and feels natural. Now, which material would be critical to make sure that that crown doesn't feel too heavy, but it's also very strong? Because typically, when something's stronger, it's heavier, right? So you have to be careful. You have to look at strength, but also appearance and how is it going to last inside the mouth. So again, which material property would be most critical in ensuring the restoration does not feel excessively heavy while maintaining strength? So which one of these talks about strength? Which one deals with maintaining strength? Okay. So feel free to pause the video if you still have to think about it. So the answer is density. So what density means is it's going to determine the strength of the material. That's the direct definition of density. And if you are in my board exam prep academy, you have a full study guide. I'm actually just looking at it now, a full 33-page study guide just on dental materials that goes through all of these definitions. So if you forgot that density was what you had to know, then make sure to go back and study dental materials. And if you want to be a part of my board exam prep academy course, check out the link in the description or at dentalelle.com. Okay, let's go through a couple more. So a patient presents, I've been teaching a lot today, you guys, I'm sorry. A patient presents with recurrent sensitivity under a composite restoration. Upon examination, microleakage is suspected. Which mismatch in material properties is most likely to have caused this issue? So, when you're answering these questions, you need to know what A, B, and C, and D mean. Like, you need to understand them. So, what I tell my students when you're going through mock exam practice or case studies, don't just answer the questions, don't just memorize, but did you understand why that question is the most correct? And what do the other ones mean? What are the rationales of all of the other ones? That's very, very important. This is called critical thinking. And I teach this inside our live classes on Sundays. But even if you're doing it on your own, think about it while we're going through this together. So, what would the answer be? So, the key points in this case study is a patient presents with recurrent sensitivity under a composite restoration. So, they have a composite filling, but they're still sensitive. And then upon examination, you're looking and there's micro leakage that is suspected. So, if you knew this, it's very rare to get micro leakage under a composite filling. It's more so common in amalgams. But if it did happen, what was the issue? A, B, C, or D? So think about it and feel free to pause the video if you need more time to think about it. So the answer is thermal expansion um, is happening between the tooth and the restoration. So, what does that mean? When we're talking about thermal expansion, that means two temperatures. It eventually expands a little bit. Anytime we're placing a filling inside the mouth, it has to be biocompatible to be able to handle mouth forces. Temperature of eating things too hot or too cold, the pH of the mouth, there's many different factors. But anytime we're placing a filling, because we're placing it into a hard tooth structure when a filling is soft, it does become hard, but it's soft to begin with. So as it's molding to the mouth and setting, it's going to expand or sometimes even contract. It's normal to have a bit of both. But if we're noticing micro leakage, then it has expanded too much. There's been expansion and contraction too much to cause the micro leakage. And if that patient is sensitive, think about it. What does that mean? It means the margins are compromised. It means our saliva and all of that is getting into that tooth between where the filling sits and the natural tooth enamel. It could be traveling down to those dentinal tubules, which is causing the sensitivity. So think of all of this in a critical way. Let's go through another one here. Now, a dentist places a ceramic crown on a posterior molar. Which property of the material makes it ideal for withstanding masticatory forces? So, a ceramic crown isn't the strongest crown out there, but he placed it on a posterior molar, so there must have been a reason. You can still do it. But what property of this ceramic material makes it ideal to withstand those heavier forces? When I'm thinking of a posterior crown, I think a gold crown is the best because it's going to be the strongest. It doesn't look the best because it's gold, but it's the strongest. If you want it to outlive you, get a gold crown. But this dentist decided to do a ceramic crown. So feel free to pause the video if you need some time to think about it. So the answer is high compressive strength. So he selected this material because it has high compressive strength. We don't care about tensile strength. We don't care about thermal conductivity. We don't care about solubility in this case. We're talking about strength because remember, when we're talking about chewing forces, which is what masticatory forces means, chewing, we're talking about strength. So high compressive strength. So there's a lot more of these inside our case studies for the Board Exam Prep Academy. If you're looking for extra study material, I can help you guys. I can leave the link for you down below or even just keep checking out this YouTube channel. There will be more videos like this one to test your knowledge. And if you haven't yet, join Dentalelle on Instagram where there's updates every single day. There's mock practice, there's Instagram stories. It's just easier for me to update there. So definitely check out Instagram if you want to see more like this. And send me a message, email me, go to the website, chat with me anytime. If you have any questions, I am very happy to help. Click like if you like this video. That would be fantastic. And I'll see you guys in the next one.